the key points of this test, I think it might have some scopes in terms of prevention, and this is something actually we are investigating at the moment. We don't really know which is the optimal score or which are those movement strategies, I would say, potentially leading to an ACL injury. It's something that we are little investigating right now. But the key point, if you're talking more about ACL rehabilitation, is, as I said before, you want the player performing these basic movements in a nice way. Bit my point around modifiable risk factor. I completely agree with you on the movement perspective. I do think that from a testing, assessment, and retraining as well point of view for ACL in rehab, we need to be really careful also around neurocognition and the ability of the player to cognitively cope with the demand of the training and games going forward.
Particularly around the knee and non-knee spanning musculature, which we'll maybe discuss later. In terms of the screening of movement quality, so we've developed like the CMAS, generally a 9 or a 10 item tool based on these high risk postures that increase generally knee abduction moments, but it's normally loading in 3 planes. So your knee abduction moment where the distal part of the tibia moves away from the midline, got that anterior tibial shear mechanism normally with those extended knee postures, and then the tibial rotation component of it as well.
My point is teaching, and is what generally do even like in the rehab setting. I just simply, via some reactive drills, I will try to stimulate the attention of the player and then trying to help them to identify the right moments to produce like a sharp acceleration to attack the opponent, rather than maybe it's better to give yourself a little bit more time to try to interpret and understand the environment and the situations. And then
welcome to FSI Talks, where football experts from around the world share practical and updated knowledge with the FSI community.
Welcome to FSI. This is the FSI Talk, where the best experts in the world come together to talk about football. My name is Alberto Fílter. I'm FSI Lab Manager, and I will be the host of this talk. Today, we are going to talk about early detections of ACL injury with, to me, 2 of the best experts on this topic. With us, we have Tom Dos Santos, Metropolitan University professor and top researcher, and Filippo Piccinini, rehab coach of Physiokinetic Company in London. Welcome, guys.
Thank you, Alberto.
Thank you, Alberto. Thanks for the opportunity. Look forward to it.
The first question is easy. I would like that you provide us a simple, very brief of your background, academic and experience.
Tom, you can open.
Okay, great. Yes, so I'm Dr. Tom Dos Santos. I'm a senior lecturer at Manchester Metropolitan University, based in the north of England. So we have 2 good football. Well, Man City are very good at the moment. Manchester United aren't doing so great at the moment, but yeah, 2 good football teams there. I passed my PhD 4 years ago, where I was looking at change of direction biomechanics from both performance and injury risk mitigation perspectives, in particular ACL injury. I'm currently a physical performance coach with England Para Football. So I work with their partially sighted futsal players. We achieved a silver medal at the World Championships last year. And I'm also a co-founder of Science of Multidirectional Speed, which is kind of like an online platform where we specialize in providing education material around aspects of multidirectional speed, strength conditioning, injury mitigation. And currently we're working on several research projects looking at ACL injury. So we started a PhD with Manchester United FC with the women's squad. I suppose we'll expand in more detail later about the potential issues in the women's game, potentially at the moment. So we've got looking at a PhD, looking at multifactorial risk factors and trying to put some screening and interventions in place. And also working with several sport technology companies looking at lower limb screening as well. And I've got a few other external PhD students looking at ACL injury risk screening as well.
Top as a background. And I think that Filippo, it's different experience with football player now in Physiokinetic Company. Filippo?
Yes, definitely. So first of all, Alberto and FSI, thank you very much for inviting me today, and Tom as well. Such a pleasure to share some time with you today. My name is Filippo Piccinini. I'm the head of late-stage rehabilitation and sports science for Isokinetic Medical Group London. I'm currently also toward the completion of my PhD with St. Mary University. As you said before, I'm really keen as well on ACL injury, obviously earlier in my research career than Tom, but I like to think that I'm more like a applied researcher, because currently I'm investigating what we do at the moment with Isokinetic in terms of ACL rehabilitations in professional and amateur footballer. Specifically, my PhD is going to cover what is late-stage rehab related in ACL injuries, and specifically workload investigation during on-field rehab after an ACL injury in a professional and amateur footballer. First project I've just finished and completed was like a cohort of 100 ACL reconstructed footballer, 20 of them professional, 40 and 80 amateur. And we simply just described the amount of workload they complete and were monitored during the on-field rehab with GPS technology. So hopefully in the future, I would like to try to bring a little bit more light on this topic. Especially my aim is to try to bridge as much as I can the gap between what we know is a rehab-based for ACL injuries and anything that is on field and early team training reintegration back with the team. So thank you very much again for having me today.
Thank you so much. Amazing background. As people can listen, that the background is amazing, academic and in terms of practice. And the first question that's come to my mind is about the incidence of ACL injury. The incidents are not decreasing. We continue with the same number of ACL injury per season, even if it occurred earlier. Prevent ACL injury is a myth or reality? Or are we going on the right way?
Which is your perspective, Tom?
Am I going first? What's a question? I suppose with any task, an injury, muscle group, ligament, muscle tendon, bone, I think there's always going to be some inherent risk of injury. I don't think we can fully eradicate any injury, but in particular ACL, I think we are being very wishful thinking there. It's very difficult to monitor the ACL load in history, especially in vivo, and it's not going to be practically feasible. And there's always going to be some inherent risk of injury, especially for knee injury, ACL injury in particular, during these high mechanically loading tasks. If you don't want to, or the only way to probably eradicate injury is not to play the sport, which just isn't going to be sensible. So performing these potentially hazardous tasks, such as decels, jump landing, change of direction, there's always going to be some inherent risk when performing those types of actions. And it's going to be very difficult to 100% what we eradicate them. What we do know that there are modifiable and non-modifiable risk factors, so we can definitely reduce the relative risk of sustaining a non-contact ACL injury by addressing those modifiable risk factors. So there are a whole range of modifiable risk factors. Probably the main ones that we're interested from like a strength and conditioning, sports science and medicine perspective is probably the physical capacities. So particular strength qualities, movement biomechanics, the way that we move, our muscle activation strategies, potentially even monitoring training load as well, because ultimately any injury to a tissue occurs when mechanical load exceeds the tolerance capacity of that tissue. So there's kind of a few areas that we can go down. We can either improve the strength of the tissue. So it's very easy to do it for muscle, potentially tendon, bone. It's quite hard to monitor tissue adaptations and strength adaptations in the ligament itself, especially in vivo. And what we could do is reduce the potential to generate these large mechanical loads. So improving the physical capacities, the co-activation, particularly around the knee and the non-knee spanning musculature, but also our ability to generate these large mechanical loads, but mainly through the way that we move. So there's lots of evidence showing by engaging in good structured strength conditioning, we can definitely we can substantially reduce the risk of non-contact ACL injuries, particularly in female adolescent athletes. A lot of the evidence seems to be evident there. What I would say is probably one step further is we probably should try to, rather than giving these blanket injury prevention programs such as the FIFA 11+, which is great kind of at community level when your sports coaches may not have the same knowledge as a physio or a sports rehabilitator or a strength conditioning coach. But I think at the elite level, we do need to try and be individualizing our programs and trying to do some individualized screening. And for me, I'm very much interested in evaluating the way that we move during these injury scenarios in soccer, such as decel, pressing, jump landing, and change direction, and then putting interventions in place. I know good clinics like ACLR Medical Group have got a good comprehensive screening battery where they do profile these movements. In my opinion, I don't think many football clubs will be doing this with their players, and there's a whole range of reasons coming down from time, logistics, potentially costly laboratories, but there are simple things we could do with our smartphone now just to be profiling athletes' movement. So I don't think we can 100% eradicate them, but we could definitely reduce the relative risk by addressing these surrogate measures of injury risk. And I'll let Filippo give his thoughts.
Yes, Tom, thank you very much. And obviously, I completely agree with you. First of all, I like generally to use the word as you used very well, try to mitigate or reduce the risk of an injury, because it's very hard to talk about prevention, especially when it comes down to, I think, ACL injuries. As you said, there's so much attention now on neurocognition and biomechanics, etc., after this specific type of injury. We know that around 88% of these injuries are non-contact in nature, so I think there's a really good window to try to do something there. Recently, we have quite a lot of studies showing also how technically the injury happened from a biomechanical, but also situational pattern perspective, and I think this is probably the key point. I like usually when I've got some students in the clinic and we have obviously a conversation around ACL, I generally invite them to observe the ACL injury from different perspectives. So there's some studies, I think they're really kind of like biomechanical and medical driven because they study the exact moments where the injury happened. There's I think Helligo Keller with our research group from ACLR did a fantastic job in trying to describe how the injury happened. But at the same time, if we have a look also about the match and game demand and the way in which it's evolving, this injury generally happen in the first, most of them at least, in the first 15 minutes of a game, where technically we have the highest intensity in terms of like game demand. So my question now is, there might be a correlation with the increased demand of a game. Some study, they're telling you that there's actually not that much correlation between ACL injuries and match demand, whereas on the other side, for hamstring injuries, for example, they're on a race because there's more high intensity actions and situation. But I think the interesting point, it can be around the ability of the player to interpret the game and interpret the scenario and the match situation. This is probably where I think might be the key point going forward in terms of trying to understand how to train players to read and understand the situation they're experiencing in football better, to a point that they're then producing a much better motor outcome from a movement point of view. So I think it's not too much the game demand, but it's probably more, it seems that players are a little bit slow in interpreting the situations, right? When they have, imagine like an opponent much faster and rapid, and then probably they're not simply coping with the intensity of the game. So I think definitely there's a neurocognitive component, and I believe, as you said, completely right, there's so many modifiable risk factors potentially we can act on, starting from the way in which player perform deceleration and change of direction, because at the end of the day, most of the time they happen in that specific situations, until training the player, for example, to cognitively be able to interpret and read the situations faster in order to produce a better movement outcome as a consequence of the interpretation of the environment. So I think we can probably talk about this later, but I believe obviously non-modifiable key risk factor, they're like probably the only one that we can realistically act on. Movements playing, I think, a massive role in the injury, especially the non-contact. I do think that, and again, I'm trying to deviate a little toward female football, but everyone knows, unfortunately, lack of resources, facilities, etc. Maybe they don't have the same attention as male footballers, which means maybe from like a strength or a functional point of view, like, you know, their body is not functioning in the same way. Maybe they're not coping with the game demand that much. So maybe for female football, the reasoning is a bit different. It might be also the increment actually of the game demand, potentially exposing them to that injury. But a key point generally I bring to the table every time is the exact moments when the ACL injury happened. If we review slow motion videos, you know, and there's so many out there, it seems actually that the ACL, they're a few milliseconds later after the beginning of the deceleration phase. So it means that the player needs to be involved in a really high intensity deceleration, I think, to make the ACL tear. It's not just about the wrong movements, but it needs to happen to a certain intensity as well. And I think the confirmation can be some studies from Stefano Di Paolo, for example, is a biomechanist from Italy, which is explaining us that many healthy footballers do actually elicit ACL-specific mechanism in terms of injury, but they don't pick any ACL injury. So the explanation it might be behind also, they need to end up in the exact situational pattern, but at the same time, it need to happen probably at a certain intensity, because obviously if the player is not hitting that intensity, as you explained very well before, like the tissue is not failing basically because the intensity probably is not enough. So honestly, I'm personally very fascinated from the topic and probably will stay here forever. This is a bit my point around modifiable risk factor. I completely agree with you on the movement perspective. I do think that from a testing, assessment, and retraining as well point of view for ACL in rehab, we need to be really careful also around neurocognition and the ability of the player to cognitively cope with the demand of the training and games going forward.
Very, very complex answer at the beginning, but let's start from the start point. For those people who are not familiar with this topic, could you define ACL risk factors?
Well, yeah, it depends, because there's a lot of different research groups that have different definitions in terms of what they perceive to be a risk factor. So some will argue that there must be some sort of prospective, maybe association and prediction with injury. For me, if you look at some of Carl Hoven's work, which has been very thought-provoking in terms of how injuries occur, I think they're kind of suggesting and arguing kind of any factor which kind of links to either material strength factors or mechanical loading. So if we break down all these particular type of risk factors, and myself and Filippo discuss some of them, but we can break down into different categories. So you've got like anatomical risk factors, hormonal in the case of females and women, which we can touch on. You've got your biomechanical, neuromuscular, neurocognition, socioeconomical, which Filippo excellently highlighted about some of the inequities that women are potentially facing, particularly in female soccer. And then we can even go to the extreme and looking at genetic history, family history, environmental risk factors. It's quite interesting. A lot of the evidence seems to show that it seems to be on dry pitches. Even technology risk factors as well. I know there's a lot of debates about whether there's a female-specific football boot that should be designed, an artificial filter potentially increasing risk of injury. But essentially it comes back down to tissue failure and tissue strength, and how these complex internal and external risk factors interact together to essentially result in a high injurious load during a single event. And again, there's a lot of evidence now, probably more in kind of cadaver models, but there's this kind of suggesting that actually the ACL injury could be an overuse injury, and it could be due to tissue, like a fatigue failure mechanism, where you're getting repeated bouts of high intensity loads, maybe over a chronic period this time. So I'd encourage viewers to watch Sophia Nymphis's presentation at the FIFA conference a few months ago. And actually, athletes perform hundreds, if not thousands, of these high intensity actions during training and match play without getting an injury. But why is it that one scenario, because although there seems to be a greater proportion after 15 minutes, there can occur at any event during the match, why is it that one scenario that results in that ACL tear? So it could be they've displayed those high-risk biomechanics that Filippo was discussing, or could it be that what was previously a submaximal load, which they could tolerate, imagine the tissues gradually getting weaker and weaker and weaker, that previously submaximal load now becomes a maximal load, and there's just been an imbalance between regeneration of the tissue and damage of the tissue. How we go about monitoring that, I don't know just yet. I do think monitoring our high intensity actions is important. So obviously GPS technology is important. I don't think any study has previously quantified the prior mechanical loading activities prior to these ACL. So I'd love Isokinetic Medical Group, some other researchers to look if they could get the access to the technology. So I know Francesco Aolia, I believe that's how you pronounce his name, has started looking at the kinematics and the GPS associated metrics of injury inciting events, but it'd be good to monitor what happened maybe 3 or 4 weeks prior for that athlete. Was there a rapid spike in training load before or after, or is it acutely there's been rapid mechanical loading as part of the warm-up, as part of the first half, and that's eventually resulted in a submaximal injury. But that's kind of like a future area of direction. It would be very challenging to do, but I think that's another area that we can do, because there is a little bit of evidence now. I think FIFPro were looking at some of the prior training loads of the women footballers, and a lot of them had, prior to their ACL injury inciting scenarios, but a lot of matches within 5 days, within a 28-day period, compared to uninjured controls. So maybe there's a little bit of evidence for this kind of gradual fatigue or fatigue failure mechanism. And although this is qualitative research, Dr. Lee Harrington interviewed some athletes more from netball and hockey backgrounds, and they felt fatigued a week prior to the ACL injury inciting event. So that's something that we're looking to do, to try to have a better understanding of maybe of some of the psychophysiological responses maybe that led to an ACL injury. I know I've gone off on many tangents there, but there's a lot of potential risk factors there, but I'm really interested in the ACL loading history potentially as a potential risk factor.
Tom, I'm with you completely, especially from a workload perspective. It's interesting because the ACL is technically considered like a passive structure in our body, but at the same time, you react to load. The studies out there, they monitor via MRI the thickening of the ACL in female football from the beginning to the end of the season. So at the end of the season, the ACL is thicker if it doesn't break down. So which means it technically responds actively on load. And obviously, it's the same thing that we as coaches, we have under our eyes every single day when we rehab ACL players on the football pitch or in the gym. If you deliver the right type of exercise, and there's a little bit of load every time going through the ACL is getting stronger and stronger and stronger. But obviously, as you said before, Tom, it's very true. If this load is too much concentrated in a short amount of time and it's too much versus the capacity of the ligaments, obviously the ligaments there. I think a really key point, probably again discussing about football, is something I try to keep in mind when I rehab ACL players, is the fact that our neuromuscular system is actually designed to absorb and produce force, but mainly to try to absorb a certain amount of force. The extra force that the neuromuscular system is not absorbing is generally absorbed via passive structures, for example, ligaments in our body. So my point is, as Tom said before, very, very correctly, that if we have like a fatigued player, and obviously the player is going through a certain high intensity movements, the likelihood probably the ACL to happen, it's a little bit higher, especially if the player end up performing a certain movements related to the situational pattern that we discussed before. So obviously monitoring the readiness, I would say, of the neuromuscular system especially to produce absorb first force, and then we have obviously today force plate and different system, I think is potentially like a key point to try to understand the fatigability, I would say, of the tissue, not obviously invasive or like straight to the tissue, but to try to have like a general understanding of the fatigue of a player, because there's some controversial thought, I think, around fatigue and ACL injuries, but so far we know, for example, there's some study, they talk about improve the inflection actually when the leg is fatigued, which is a bit of a paradox, because generally the ACL happen because players simply don't absorb and don't bend the knee enough, during the catting or deceleration movement. So I think there's still many controversial thoughts. The workload, I think, is a very key point, because as we know, it acts as a kind of like moderator to strengthen our body and the tissue toward back to football if you're coming from a rehab, but at the same time it can kind of like break players down if it's too much in a short amount of time. I'm very keen, generally probably slightly biased, because I come more like from a rehab. I'm SNC, but sports science, but I experience the rehab environment every day. We're very keen in isokinetic generally to try to develop sufficient movement quality in our ACL players before they transition back to football, for example, even just together during on-field rehab on the pitch again. This is simply because we believe that if the player is not moving in the right way, his body is producing an extra amount of internal forces that the body itself needs to handle, and this potentially is leading to extra cognitive and physical work for the player in trying to maintain a good movement quality on the pitch rather than focusing the attention too much on the ball or the exercise. So I think a key point probably in terms of trying to mitigate the risk of injury or work on potential modifier risk factors, we said, trying to spend some time and teach player how to produce, for example, better deceleration, better change of direction, sometimes just in a pre-planned way, because you're simply adapting the tissue via eccentric mechanical loading. At the end of the day, via momentum, you can just simply create a certain amount of stress through the neuromuscular system, which is obviously related to the intensity of the exercise. But even if they are pre-planned, they're technically teaching the player how to perform that movements in the right way. And I like personally more in a rehab setting, but I'm not sure, honestly, with healthy player, but potentially you might get some transfer as the brain learn into like some more like football situations. I like to think that if player have better deceleration strategies, they can potentially break a little bit better on the football pitch. And if they find themselves in exactly the same situations where potentially the ACL can happen, they at least have this extra protection coming from their ability to produce better deceleration with much more quality, dissipating more amount of load in a shorter amount of time, for instance. So I'm generally very keen on everything that's like movement related, because I do believe that it plays an important role when you're rehabbing an ACL injury, but we don't actually have so much evidence out there, right, in non-injured footballer to see if there's actually a really protective effect. We're doing some studying at the moment with isokinetic on 90-degree pre-planned change of direction, but we're noticing that if players have a predisposition for an ACL injuries because they don't really have a high quality change of direction in terms of especially the kinematic component. So their ability to cut most of the time is characterized by anticipatory strategies. So they don't really have the right strategy when they produce a 90-degree change of direction. And generally, if this is already placing a certain amount of strain through the knee because the quality of the cut is not good, I'm just trying to figure out when they're actually playing football in a really chaotic situation. This is probably an explanation already, and maybe we'll talk about later, but I think a really key window we have is generally with young players, actually, when they are in that phase of a career where they're not just learning how to play football, but as coaches probably teaching them how to move a little bit better on the football pitch. I don't know how many footballers you work with, but the one I usually work with, I won't say they move well on the football pitch. They play football really well. They're really good technically, but I won't say they move well as athletes. So maybe movements can be like a key area going forward.
Have you mentioned the movement quality, focusing on these isokinetic variables? I would like that you provide to listener your test in the case of Thomas, the cutting movement assessment score, for Filippo, the maths and movement analysis testing that you apply in isokinetic.
Great. Yes, so really excellent points there, Filippo. So essentially, I think for ACL injury prevention, I kind of got like 4 pillars. I will talk about screening in a second. I think we have touched upon them. So I think the periodization and monitoring of these high intensity actions is something that we can do as practitioners. Filippo's talked about the neurocognition element. So if we can make better decisions, have better reactions, make better decisions. I think a lot of these ACL injuries, especially on the women's game, I don't mean to cause offense, but I believe some of the ACL injuries are bad pressing movements. Now, I know we do need to press and try and win the ball back, but not necessarily every single accel to decel has to result in winning the ball back. We can delay the opponents. And I think, again, coming across that Ali Okula's paper, that there are some poor errors that can lead to those high risk or situation of no return. So yeah, developing that, because we know that the mechanical loads are significantly greater and the muscle activation is in proportion to offset that load. As Filippo was discussing, yes, we can alter our movement strategies. So essentially, we do need load to create stress in order to adapt, but excessive. So I was trying to get that kind of Goldilocks effect, not too much, but not too little. But in terms of modifying our knee joint loads and the moments, we can either reduce the impact ground reaction force or the moment arm. So normally the kinematics linked to moment arm. So for example, knee valgus increases the moment arm in the frontal plane relative to the ground reaction force vector. That increases strain on the ACL. So we have shown in as little as 6 weeks, you can modify the way that athletes move during cut-in and jump landing movements by simple cueing, using pre-planned drills. I won't get into the debates about whether we use pre-planned. I still love pre-planned drills because you're improving the action capacity in a controlled environment. It kind of leads into the screening and obviously improving the physical capacity. So particularly eccentric strength, isometric strength, and particularly around the knee and non-knee spanning musculature, which we'll maybe discuss later. In terms of the screening of movement quality, so we've developed like the CMAS, generally a 9 or a 10 item tool based on these high-risk postures that increase generally knee abduction moments, but it's normally loading in 3 planes. So your knee abduction moment where the distal part of the tibia moves away from the midline, got that anterior tibial shear mechanism, normally with those extended knee postures, and then the tibial rotation component of it as well. So we developed this tool. It's based on the posture. So if we start from maybe the head and work our way down, so we're looking at trunk positioning. Generally, you laterally flex trunk over the stance leg, or trunk rotation to the stance leg increases those knee abduction moments. So what we're trying to do is encourage medial trunk lean in football, which we can do with simple cues such as lean towards the direction you're going. In other ball carrying sports such as rugby, American football, handball, it's a bit of a tricky area because we do sometimes cue our athletes to drop the shoulder and have the ball actually in the hand where the stance leg is, which can actually increase knee joint loading. But again, there's always this performance injury trade-off. Some of the mechanics necessary performance could be at odds in terms of injury risk mitigation. As long as coaches and players are aware of that, again, that kind of leads to this debate whether we can 100% eradicate ACL injuries. I don't think so, because we can't wrap our athletes in cotton wool and just do curvilinear sprinting. I know you love curvilinear sprinting, Alberto, but we do need to perform these aggressive type of actions. So we screen trunk position, and then we kind of work our way down. I'm really interested in the penultimate foot contact and the potentially the steps prior. So depending on your approach distance, change of direction is a multi-step action. Typically for our more aggressive change of directions, maybe 60 degrees and greater, there's definitely going to be some preliminary deceleration involved. What we do notice is in a lot of these ACL injuries, there's very minimal braking, and then they save it for this one footstep, which has to try and dissipate all this load across one step. If we can actually dissipate this load over multiple steps, generally in the sagittal plane, which is safer because the ground reaction force vector is going through the knee, rather than trying to do it in a rotated position with a lateral foot plant, which is, for instance, these kind of more multiplanar knee joint loads, we can definitely substantially reduce the risk of injury by trying to encourage these penultimate or anti-penultimate foot contact dominant braking strategies. So we look for that. We're looking for lower limb positions related to the amount of knee flexion they go through. So some people argue most of the ACLs seem to occur within 30 degrees of knee flexion. And if you look at some of the modeling and Padova type of styles, it seems to be the greatest strain is within that 0 to 30 or hyperextended knee joint. I believe as Zlatan Ibrahimovic and Kurt Zouma both had hyperextended knees when they did there. So again, it significantly increases the knee joint loads. We look for trunk position in the sagittal plane. So there's adequate hoe flexion at the hip. So it isn't just the knee. You're seeing a lot of these kind of knee dominant strategies with the trunk behind and the foot in front of the body, particularly during landing style type of ACL scenarios. Then we're looking for foot plant widths. Again, you need that lateral foot plant in order to generate perpendicular force to deviate and deflect your center of mass, but you are increasing the moment arm in the frontal plane, which can increase your knee abduction moment. Again, if you're going to tell your athletes to avoid these wide foot plants, I don't think it's going to be that feasible. But what we definitely don't want is the wide foot plant combined with lateral trunk flexion and rotation, with hip internal rotation, maybe with a potential heel strike, and dynamic knee valgus seems to be that worst case scenario. So we're screening for kind of dynamic knee valgus at initial contact and overweight acceptance, hip internal rotation, foot rotation angles, also another thing we need to consider, ideally probably a neutral foot position, but having your foot excessively internally rotated can increase the knee abduction moment. Having your foot excessively externally rotated can lead to a pronated and maybe a tibia rotation aspect. And then a big debatable area is how the foot makes impact with the ground. So a lot of the evidence seems to be showing that a ball of the foot could be safer from an ACL perspective. However, you are going to increase your ankle risk of injury if you are going to try and change the direction on the ball of your foot. Heel strike, it depends on the change of direction action. If you're going to do a 180-degree turn, then you probably will have a heel strike. I do find from screening the change direction videos and coaching change direction, normally a heel strike's a product of poor prior braking. So if you imagine an athlete runs through, they don't brake effectively, and then they have a large anterior placement of that final foot contact, which does result in that heel strike and a large impact ground reaction force. But from a performance perspective, maximizing that surface area that we push off upon is effective. So I normally encourage like a mid-foot joint change direction with good pilotal foot contact braking or preparatory postural adjustments. And this is where it comes back down to the neurocognition element. If we can better anticipate or make better decisions, that's going to afford us greater preparation times to make postural adjustments, not only from a technical perspective, but also activating our musculature, because there is evidence showing if we can adequately activate our knee and non-splenic musculature to a greater extent, that does assist in ligament unloading as well. So that neurocognition element is important. But we essentially film athletes' technique in the frontal and sagittal plane. What I will say is athletes do pre-rotate, which increases susceptibility as parallax error. So if I'm rotated towards you right now, it's very difficult for you to see the front of my chest because I'm already rotated. If we're trying to evaluate knee position, it's the same thing. As soon as the athlete pre-rotates, because if you can rotate early, you're reducing the redirectional demands, but it's quite hard to evaluate knee position if the athlete's already rotated to 45 degrees. So where possible, we do try and encourage maybe an additional camera, which is maybe set 20 to 40 degrees to change direction, just in case those athletes do pre-rotate. However, one caveat to get around it is I initially start off with pre-planned tests and then I go on a continuum. Some athletes don't probably earn the right to have these more advanced tests with flashing lights, externally directed attention. If the mechanics are poor pre-planned, I don't think we need to worry about that stage. Maybe where some people misinterpret our research is we're just saying doing pre-planned. If an athlete has good mechanics pre-planned, we're not saying they're 100% safe. Challenge them with fatigue, externally directed attention, generic dual attention tasks, and maybe sport-specific tasks along that continuum to see if and where they break down.
Absolutely, I think that you have one of the best and simple tests that we can find now.
And yes, we have validated. I forgot to say we validate against 3D motion capture. So we found athletes with greater scores and trials with greater scores. They have greater 3D and knee joint loads, so knee abduction moments, knee rotation moments, and kind of knee flexor moments as well. So it has a good validity. Some other screening tools, maybe such as the tuck jump assessment, or quazzles, more landed assessments haven't been validated. The LESS and the screening tools which the IsoConnect group have developed have been validated to 3D motion capture. So they would definitely be tools that I would recommend, which is a very important thing. So it's been validated to be an indicator of surrogate measure of ACL injury risk, but we're not saying if you've got a greater score, you will go on to sustain an ACL injury.
I think that's in the isokinetic you use more than 2 tests, right, Filippo? How many tests do you use?
Yes, like basically, as Tom explained, like we generally use a 2D biomechanical evaluation system, which is obviously been evaluated and tested on 3D. But the idea is simply we try to train and evaluate the player across 6 basic movements. They generally are progressive in complexity because you start from a single leg squat and then you progress into like a drop jump. And then they perform deceleration, lateral stopping, cutting, and single leg up. So these are the 6 basic movements that we generally check. Everything comes down as a final score, very similar to the evaluation suggested from Tom. We generally look at like knee control, pelvic control, and trunk control. More like sideways, we generally evaluate the ability of the player to absorb a certain amount of like force, obviously via qualitative, again, evaluation, because players generally tend to land in every moment on a force plate. So we have also everything that is also not only kinematic, but also kinetic related. We have evaluations from peak ground reaction forces, the ability of the player to absorb that amount of force in a certain amount of time. And obviously we do compare right and left. The main reason why we generally do indoor is just because following our rehab method, there is also a room where we actually do train the player after the test or before. It's like a very simple open space environment where we do generally retrain, especially ACL players. We train them to move more efficiently and better, if it makes sense. And then we use the test to evaluate the improvement that they gain session after session. I think the idea in some studies that we're conducting is to try to understand which players has a certain predisposition for an ACL injury. So like the study I mentioned before, which they're at the moment, they are evaluating more than 1,500, I think, non-injured player through a 90-degree pre-planned change of direction. Again, like kinetic and kinematic evaluations via the validated system. But at the same time, if you think more the system into like a rehab setting, it helps you to consistently monitor the movements improvement of the player that is actually gaining session after session. The simple idea is you try to improve and optimize the quality of the movements that the player can produce across different movement plans before you transition them out on the football pitch. The reasoning is simple. If you have like a knee valgus, and obviously, as Tom explained, like during like a knee valgus situation, there's a certain amount of load going through the ACL. If you're simply producing the same movements on a football pitch, a higher intensity is just simply putting more strength through the ACL. So via a good biomechanic, so via good movement quality, we like to think that, again, the neuromuscular system, which is designed to absorb and produce force, but particularly accept load through the neuromuscular system, it can potentially help the player to protect the ACL, and especially, let's say, give to the ACL a certain amount of load session after session. Might be like a little bit complex, but let's think about, again, like a series of deceleration you're doing with your ACL player first week on the football pitch after, let's say, 4 or 5 months. We don't, as Tom said before, we have no idea how much load is actually going through the ACL in vivo because we cannot know that. So generally, we just monitor the reaction from the knee. But if you have a player with an optimal movement quality, which is, as we said, we evaluate via this system, I'm pretty confident that the same amount of deceleration is experienced in a different way versus a player that is actually not moving sufficiently well enough during that specific task. So the goal is we want to see a certain amount of quality in the way in which they produce that 6 basic movements before we transition them out on the football pitch. Today, we are also trying to understand an optimal scoring, just to give some like reference values. So for example, anything above is generally a test that will lead to a score that is around 100. But we generally investigate different areas. They, as I said, they rank from limb stability to pelvic stability to trunk and shock absorption. And if you cross them with each of the 6 movements, they give you like a final score of approximately 100. So the useful thing, which is I think a key point, maybe Tom agree with me, when you're rehabbing an ACL player, it's important to try to make them aware about their progresses. So if you're pushing them through a certain exercise or a certain sequence of exercise, or even like a certain phase of the process where you're trying to impact heavily the way in which they move, obviously you need to explain them why they don't move in a certain way and why you want to change actually the way in which they move. So by objectifying that movement's improvement, we can also create more buy-in and explain to the player why actually we need to change that in the view of going out on the football pitch. You know, pro footballers generally, they can't wait to be on the pitch again. So sometimes we hold them back too long, you know, they start to be a little bit upset. You need to keep them focused on the sessions, etc. But I generally, when it comes down to some like numbers, simple picture and some explanation, they actually like to see something change in our body, hopefully in the right direction. So yeah, this is just a little bit of the summary of the test. We generally run this test at least a couple of times as an initial test. So we want to, when we obviously think the player has sufficient criteria to be tested in that test, obviously they do it most of the time sub maximal speed. But at least we have an overview of which is the movement's quality, which is basically their ability to produce a certain movements across 6 tasks. And then we try to correct or adjust eventually some movements that we might consider dangerous from a re-injury point of view. And this I think is the interesting part. If we go down, for example, to the deceleration, I've had so many ACL players, they tend to land on their force plate extremely knee dominant in terms of landing. So we might think, well, this is probably like some eccentric inability of the quad to contract because it's still early stage, it's the first time doing the movement, and it definitely can be. But an important point to remember is that, again, our neuromuscular system is designed to work through different muscle chains. Some muscle chains, they are pretty dominant in the movements. Some other muscle chains, generally, they provide stability and they counteract the amount of force that other muscle chains produce. If you pick, for example, like a deceleration, which is a pretty anterior chain dominant movements, you actually have the whole posterior chain, especially hamstrings and knee stabilizer, but glute max. Specifically, they tend to offload the amount of force going through the knee joints. And as Tom explained before, it makes a huge difference if you're landing front foot or if you're landing on your heels or if you're landing in a neutral position. So we deliver, for example, a lot of attention around the foot planting. And I do believe actually that just because I like, for example, to ask the player to perform some cutting before I gave them some correction, because I want to try to actually understand the way in which they move rather than just dragging conclusion from my biomechanical assessment. And it's interesting because even if you're rehabbing a player coming back from an ACL injury, they do actually show the same movement pattern probably they put in place before the injury, because simply they haven't done any neurocognitive process where you actually intervene to change the way in which they move. So the interesting bit is you ask them to move for the first time, you ask them to produce a change of direction, and they will probably do exactly in the same way the ACL injury happened. And this is where you actually start the correction, especially when there's a non-contact injury around, because the key point is you don't want to transition the player on the pitch with that pattern, because you know already it's dangerous because he had the ACL injury already, likely in that situation. Obviously, in pro football, you have video analysis and any information that you need. But the key points of this test, I think it might have some scopes in terms of prevention, and this is something actually we are investigating at the moment. We don't really know which is the optimal score or which are those movement strategies, I would say, potentially leading to an ACL injury. It's something that we are little investigating right now. But the key point, if you're talking more about ACL rehabilitation, is, as I said before, you want the player performing these basic movements in a nice way. You want him to or her to perform a good deceleration, a good change of direction in a pre-planned and really controlled environment prior to progress the player out on the football pitch. Because I can tell you from experience, as soon as you put the player out on the football pitch, they will try to move in the same way they actually move in that environment, because technically it's a different environment. So the key thing as a rehab coach for me is to nicely try to transition the player out on the pitch and especially work on the retention of the movements on the football pitch. So the first stage, for example, when I start to rehab players on the football pitch, is extremely characterized by movement retraining. So just apart from like restoring technical abilities, conditionings, and everything, we try to progressively help the player to move better as well on the football pitch in a different environment. This is likely a pre-planned phase. There's nothing like happening in terms of cognitive stress or reaction. So there's a really good window to actually try to get some transfer from all the time that you spend indoor training the player how to move better. And we do really think that it can potentially reduce the risk of like the player to sustain another injury, especially considering that in the first few weeks on the pitch, the player will likely try everything to compensate with the non-injury side. They generally are very protective with the ACL side, even if you train them really well, just because simply the new environments, they are technically not used to that environment and they're simply adapting. And then it's interesting, unfortunately, there's actually not too much research, and hopefully I'll maybe do something in the future, but you can probably visually see sometimes the compensation happening during some drills that you actually deliver on the pitch. But I can tell you that with certain amount of cues, some corrections and adjustments around the drill, you can actually help the player to recompensate that to a point that you're literally teaching them to move better. So they produce better deceleration with much more optimal cues. And then, as Tom said before, you make sure they move well in a pre-planned situations prior to transition into like a more reactive and cognitive demanding situation. So yeah, just to summarize, the key point for me is pre-planned qualitative movement evaluation. I think they can potentially be very key in the future with some backup and some studies on identified potential predispositions or players with some predisposition for ACL injury. But at the same time, they can be very key in rehab, because it's a continuous evaluation of the player from more like a movement perspective. And I think today is the best things that we have to transition ACL player from pre-planned situation to reactive. You want to make sure the player is moving in the right way in a pre-planned situations before applying load in a reactive football-specific drill situation, for example.
We are talking always about senior player, but the question now is what happened in academic football player. What do you think? What is the key factors in academy to change, to modify the techniques? Or the other question, what is the key age category to modify this technique? Do you think that we have a window of opportunity?
In terms of change of direction, a lot of the evidence in terms of trainability and windows of opportunity focus primarily on strength, plyometric ability, and speed abilities. There isn't a lot done from a change of direction perspective. We know with female adolescent athletes, particularly post-peak height velocity seems to be the problematic area. They start menicky, there's significant increases in growth, differences in segment lengths, which affect the center of mass within those segment lengths. Yeah, but essentially a lot of athletes will have to learn how to coordinate an extra few inches to their limbs, which makes it a lot more challenging. So we know we probably need to be introducing a bit of movement quality work as early as possible. I'm a big believer in starting resistance training as early as possible, as long as the athletes, if they're old enough to play the sport, they're old enough to train for the sport. We don't want to make it too regimental with 6, 7, 8-year-olds. People argue we should focus on the fundamentals, but there are specific things that we can do at a very young age, maybe some kind of movement games, and we just add a few cues, a few constraints to try and encourage these optimal postures. Even in racing formats, we can just tell them, when you're racing, when you're slamming on the brakes, can you just lean back or sit under a roof, and use analogies which might be good for that age group. I think we definitely always need to be doing technique work across the areas from an LTA or long-term athlete development perspective. I suppose as they start advancing through the age categories and maybe start, rather than focusing on what, maybe start to think about potential professional contracts, that's where maybe a bit more of the technique work comes into focus. So rather than focusing on play with a bit of technique acquisition work, maybe the emphasis focuses a bit more on to actually more strength conditioning, more technical feedback, right? Not just focus on playing games. Now we're actually going to start addressing your movement mechanics. And from like a neural plasticity perspective, it's easier to learn these skills at a younger age. It's easier to learn a language, it's easier to learn an instrument, and it's going to be the same when we're coaching these movements. I suppose that area of peak height velocity is the challenging area, not only in terms of ACL injuries, but a lot of growth-related pain during these tasks. So we need to be aware, conscious of the amount of load and the amount of volume that we're doing of these mechanically loaded tasks. But as Filippo said, we can reduce our entry speeds to reduce the mechanical load that we experience. So we might play about with low-level plyometrics and isometric hold drills to try and encourage the postures that we want to get into, even during periods of growth-related pain. As the athlete comes post-peak height velocity, then I think there needs to be a increased emphasis on this technique acquisition and encouraging this technical modification, but also exploring movement variability as well, not just between skill variability, but the ability to perform that same task with different strategies. Because if you have, some people argue you need a flexible coordinative approach. You can't just perform the change of direction one way, but otherwise you're just going to repetitively load the same tissues all the time. So some people argue you should encourage repetition without repetition. So when you are teaching your athlete, can you make subtle adjustments in maybe foot location or the amount of range of motion that you go through, while still adhering to some key fundamental principles. Like for example, I love coaching the penultimate foot contact, but we know not in every situation the athlete will be able to brake and decelerate in those steps. So there will be situations where we probably do need to teach our athletes how to decelerate or change direction from those worst case scenarios as well. So they've got that flexible coordinative approach. But ideally, as young as possible, but probably increase professionalization once they're kind of going to circa to post to peak height, velocity, everything. You train everything just at different densities, in my opinion. But definitely with that adolescent awkwardness is a big period. Sophia Nimpius argues maybe that period before they go through peak height velocity could be a really important opportunity from a tissue robustness perspective as well, to be encouraging this volume, but obviously be aware of growth-related pain.
I agree, Tom, and I think like generally there's many kind of like long-term athletic development frameworks out there, and Arsenal, I think they did a fantastic job a few years ago in publishing there. But I think if you consider more like middle childhood, obviously players are still focused around like fundamental movement skills. It's probably slightly too early, and then it's before the peak in terms of growth, before the puberty phase. I think the hardest period in terms of transitioning for a young footballer can be around puberty and the adolescence phase, especially because they have as you said before, they grow a lot, the muscle tensioning change, and obviously their ability to move as well get kind of like compromised. But I see in some ways as a window at the same time for this player to learn actually how to move better. If you pick the player from a too young age, for example, like the early childhood, they're probably too young, as Tom said, to try to push them through like a kind of like training, movement training routines. They're too young, so it's probably not going to be that effective. But players around puberty, adolescence, they generally know already that kind of like professional contract, they tend to be behind the corner, so they kind of like focus on their future as a footballer. So potentially, I believe that might be actually a good window, because it's a window, as I said before, where the player is actually struggling a little because the body is obviously changing, and you can potentially tackle with some attentions around deceleration, change of direction training, and you easily align that to any S&C they're doing on the pitch and in the gym, especially from a plyometric and agility perspective. I think it kind of like lends nicely, if it makes sense, in a program. Obviously, I think cues and informations that you try to pass to the player, they are extremely key. So just in case you have availability for video analysis and evaluations, you can visually show the player how they move, and then you potentially try to teach them how to improve that movement. And this is, as Tom said, this is happening via the neuroplasticity concept. So potentially that is a really key phase. It depends though what you're going to deliver, because obviously if you try to deliver pretty complex and intense, movements, a combination of movements together, it might be a little bit overwhelming for the player. You might lose their attention and you don't actually get a pretty good outcome. So my suggestion is probably to try to focus more on really selective movements. They might be a little bit more ACL kind of like injury related. So I do really believe a lot in producing better quality deceleration and change of direction as a protective strategy for players with a ACL ACL injury predisposition. So yeah, I would say puberty, adolescence phase probably is a very good window of opportunity as a coach to intervene on our player, make them a better footballer, but at the same time, I would say a better mover on the football pitch.
Yes, and this is the question now, focusing on the football. How include the context and the content sport demand in the injury prevention program? Tactical knowledge, when player has to press and he doesn't have. What do you think about?
Could you repeat that again, Alberto?
The context of tactical knowledge, technical knowledge. That we use the same screening for all sports. How differentiate, how to change the cues for football or basketball? You know that basketball and football mechanics are different, offensive, defensive. How change this to adapt to this sport, football?
It's a very good point. So I suppose depending on which literature that you read, there do seem to be a few big injury inciting events. So the defensive pressing seems to be a very problematic area at the moment. So I suppose in terms of ecological validity, as part of that continuum, yes, screen pre-plan, but probably want to evaluate how our athletes are doing these pressing type of movements, because you've got that externally directed attention. You're not focusing on your technique as such. You're focused on pressing the opponent, creating a delay, or potentially even winning the ball back. I do think it's, again, comes down to our point earlier, in those tactical scenarios, some of them are bad errors, I believe. So someone accelerates in too fast, they don't slam on the brakes, they don't recognize that they do need to slam on the brakes. And I believe there's a really good video, they probably had Francesco De Villa's group, one of the Italian players, and you can clearly see their players accelerating. The attacker is inviting the defender to press them, they're square on, and then they just shift the ball to the side. Everyone knows from watching the video what the attacker is going to do. They do need to recognize in that situation, slow down, the person's just going to shift the ball in that situation. So I think there definitely is a lot to be learned from recognizing these kind of kinematic and postural cues from a defensive and an attacking perspective. There are, I suppose, scenarios where you do get these freak ACL injuries, where particularly in the women's game, where someone might just be doing a lateral acceleration, the ball isn't even near them, but that could be more of an issue of the foot becoming planted in the ground, and there's a kind of torsional component with it when you got that foot to ground surface interaction there. We know contextually as well, a lot of them happen with some mechanical perturbation as well. I suppose we can train for that in some way with caution, I suppose, when we are performing these advanced drop landing, lander stabilization, multi-direction stabilization, that we do put some kind of low-level perturbation. I believe some of the group, maybe at the sports surgery clinic and the King out in Aspetar, they might use overhead broomstick variations, stuff with maybe with Swiss ball and bands while performing these tasks, where there is a slight perturbation in there, particularly during these challenging scenarios when either tackling an opponent or getting tackled for an opponent. There are some scenarios where you may get normally some upper body contact. So that might be something to think about in terms of conditioning our players for those direct contact or indirect contact type of injuries. So typically they will happen maybe more during your wide positions, where a fullback's chasing a wide midfielder or vice versa. And then you do seem to be kind of regaining balance after kicking, whether it's a volley in the air, a contested header, or going up for something like that. It does seem to be quite different to the ball carrying sports like rugby and basketball, where it seems to be the attacker normally trying to perform some evasive action. And I believe the Italian group, again, we've done some nice work looking at basketball, where it seems to be driving the attackers towards the key, where in those congested areas, you normally performing some sort of Euro step cut, maybe some mechanical perturbation there. Again, as well, trying to avoid those opponents in congested areas seems to be that problematic area. So again, decisions, recognizing these cues to afford you better postural adjustments and adequate levels of muscle activation seem to be a key thing. And we're hoping to do a study looking at contextualizing more the situational behaviors in the female game. But I do believe there are some poor errors made when athletes are just randomly chasing after an opponent and not slamming on the brakes. And I think the S&C coaches need to work with the skill coaches in terms of like recognizing these kind of defensive pressing scenarios and actually educate. You don't always need to win the ball back. That's why I always tell my futsal players, delay them. They'll probably force a turnover in that situation, and you're not going to get into those high risk postures potentially.
Filippo?
Yeah, I think I'm on the same line with Tom, honestly, because the ACL injury at the end of the day, it seems to be like a defensive injury. So it happened most of the time in defensive situations. And even before, I remember the last paper that we published on the situational pattern ACL injuries in Serie A. I do remember I had two footballers from QPR. Both of them, I worked with them when they're coming back from an ACL injury. And I remember I was speaking with one of the physios, and he showed me actually the video on how the injury happened. And both players, they were simply too aggressively going against the opponent, and the opponents, as Tom explained, simply moved the ball on the side and planted the foot in the wrong way, and both of them had exactly the same ACL injury in exactly the same way. And one of these two guys actually, he re-injured the same leg in exactly the same way as the first time. So I do really think that training the ability of the player, as we said before, to interpret the environment and try to understand when is needed or not to give such much pressure into like a situation in terms of like defensive situation is key, because potentially by minimizing the amount of defensive oppressions from the player, you can actually technically you can reduce the risk of a player to end up in that specific situational pattern, which is ACL related, or simply cue the player and teach him or her when is the optimal moment to do it, or ideally with the optimal intensity, especially depending on the distance that you have versus the opponent. So we know obviously this Damien Harper is doing like so much research on the acceleration, and honestly, I think he's done a fantastic job. And we know that the higher the intensity of the acceleration that you produce, the harder, honestly, the intensity you need to put in a break, because you need to break like a pretty big momentum. So my point is teaching, and is what generally do even like in the rehab setting, I just simply via some reactive drills, I will try to stimulate the attention of the player and then trying to help them to identify the right moments to produce like a sharp acceleration to attack the opponent, rather than maybe it's better to give yourself a little bit more time to try to interpret and understand the environments and the situations, and then deciding actively, maybe with the rest of the team or with your coach, which is obviously training you on the pitch, when in the right moments to do that. I do really think that some footballers sometimes just to simply put pressure on the opponents, they, I would say, produce some movements that are maybe not that much needed, if it makes sense, especially in that specific situation, that specific defensive situation. So probably going back again, deceleration, cutting, very key pre-planned movements, but at the same time, as Tom said before, they has to be contextualized in certain specific situations. So I kind of like see, as Tom suggested, some movement expert and skill coaches and S&C working together in the football team to try to design some specific football drills that the player can replicate. They kind of like help the player to be trained in that specific situations, and obviously they can try to get a transfer obviously for the player into like a match situation or training situation. So I definitely see as a coach, when it's possible, obviously depending on training routines, etc., but like a little window that coaches can dedicate to certain players depending on the position, following some investigation they've done via the video analysis, etc., where they take certain players, for example, and if they notice they don't produce the right movements, or they produce, I would say, not that useful movements, maybe they work specifically with the player, not just to correct that, but simply to show them most of the time maybe they do some movements that are not needed, and they're simply exposing themselves to some kind of like dangerous situations, but where they actually not needed, especially if we know today that happen in that specific way. So I do think the video analysis studies that we have, what we can pick, for example, as coaches, it's not just about how the injury happened, but which is the context, which is the specific situation that we need to be mindful and careful of, and how we can then design drills for our players to try to mitigate and reduce the risk in that specific situation. As we said before, players learn how to do things. They're like active persons. So I do like to think that if we teach something new, we show them the change, we show them like the impact on his performance as well from a GPS data perspective, for instance. We can have a strong impact on them, and we can potentially slightly modify the way in which they play to make it a little bit safer and more effective, if it makes sense. At the end of the day, players generally, they play football because they get told to play in a certain way, but maybe it's not the right way for the player, right? So some of them, maybe they need a certain type of training, they need to produce certain type of movements, and maybe the tactical element, for example, of the game doesn't apply to certain footballers, if it makes sense. They're not, I would say they don't have the foundation and the asset in their physically asset to complete certain situation that the manager actually want them to do, right? So I think it's not just about the player itself, it's more like a very big teamwork between manager, coaches, movement experts, or skill coaches, or like everyone needs to be involved to try to wisely identify the situation and act on the situations when possible, as we're doing, for example, by the way, with hamstring injuries. We are, like, just change of topic, but we know when they happen, we know how they happen. There's so many people, researchers now, on sprinting technique, lumbar-pelvic control, and everything that we know is hamstring injury related. I see kind of potentially I see the same thing happening in ACL injuries. We just need a little bit more applicability of the science that we're bringing now on the table, and a little bit more transfer now from coaches into practical solutions for our player. But generally, I would suggest to start from more like video analysis, try to identify those players. They exhibit certain movements, maybe they are not that needed, and they are obviously part of the situational pattern leading to an ACL injury. And potentially you can help the player to move more efficiently on the football pitch with some like coaches strategies and corrections. This is probably...
Oh, sorry, didn't know this, yeah.
Sorry, Tom.
I was just going to say, I think that's where maybe like virtual reality could be quite powerful. So even particularly during the early stages of rehabilitation, where you can get a bit more of the sport-specific work, but using video analysis, using virtual reality to recreate some of those scenarios to actually recognize when to press, when not to press. When you are in this scenario, where do you think this athlete's going to go? Because besides from an ACL injury mitigation perspective, normally when you press and you don't slam on the brakes and the person shifts the ball, tactically, you're out of the game. A lot of my work's in futsal, where it's 4v4, so that's very massive. You lose 25% of your plays as soon as the player goes past you. And I just want to highlight a lot of what we've discussed today. Yes, it's ACL injury mitigation, but it's a lot of transfer for better performance. If you can move well, you'll be safer, but you'll be more optimal for performance. And we know in soccer, it's all about these decisive, high-intensity actions, linear sprinting being one, change direction, rapid decels, attacking in defensive scenarios. But I do see kind of that virtual reality and those video-based tasks being a massive tool to assist with these kind of pressing type of actions. And we just like to say sometimes slow down to speed up.
Yeah,
could actually be quite powerful in those situations. And yeah, you'll just watch the videos back and very limited braking, and they're just literally trying to shift and deflect their center of mass on that one step. And what we've started to notice with the videos as well is they press in linearly, then they're trying to decelerate in that kind of lateral, they stretched position, and the trunk's in that very horrible position with very minimal preliminary deceleration. So you're talking potentially 4, 5, 6, 7 meters per second running in, and they're trying to decelerate on one limb while focusing. They've been distracted, the ball's gone that direction or that direction, and their trunk's rotated over that stance limb. It's horrible. So no, some really excellent points there, Filippo.
And the last question is about that. What do you think that it is the future of ACL risk of injury screening? The boom of artificial intelligence, virtual reality. I suppose that it's very difficult to achieve the reliability with all this equipment. What do you think?
I'll be giving away all my research ideas now. So I think obviously with the advancements of technology in terms of the ability to screen players, I don't think we necessarily need to be in laboratory environments anymore, or even those laboratory environments are using maybe even two-dimensional cameras. So ACLR Medical Group, they're using the video vector, which is more cost-effective than maybe a Vicon system or a Qualisys, although I do believe they do have access to that as well. So the advancements of technology is allowing practitioners to take kind of laboratory techniques in the field to potentially get more ecologically valid tests or to permit the large mass screening. So the beauty is with using your video phones with the CMAS, we've been able to screen squads in as little as maybe 15, 20 minutes rather than doing a 2-hour lab session. What I will say is you probably do need to screen a range of tasks. So the ACLR do a great group because a great range of tests because it's all task dependent. A lot of people, landing mechanics are very easy to evaluate, but it doesn't necessarily transfer to cutting mechanics. They're quite distinct tasks. And I would argue as well, a 45-degree cut is completely different to a 90-degree cut, mainly due to the requirements to decelerate. And again, it's completely different from a 180-degree turn. So we have shown injury risk profiles to be task dependent, even across change direction angles. There are some good bits of technology now using like pose estimation and artificial intelligence to potentially provide you not only with qualitative feedback about quantitative measures. So the CMAS is a qualitative tool, but if we've got the advancements maybe with markerless systems to give you objective data that can quantify the amount of knee valgus, your lateral leg plant distance, we can get some objective data and then we can subsequently inform our decisions. What do we consider to be acceptable? What do we consider not to be acceptable? And that biofeedback is very powerful from a technique modification perspective, as Filippo discussed earlier. The ability just to share some videos quite quickly and to be able to share that information, whether it's part of your MDT or to the athlete, is really powerful. So I know the isokinetic group, you've got it's an integrated screen and you can get live feedback. And I think the American group are doing some like augmented feedback where they're doing tasks and getting live feedback during them. So there's definitely some advancements there from the screening of the movement. There are some good companies giving you objective data with the simple use of a camera, and not just from a technique perspective, but maybe the entry speeds that they're going into. That's another important consideration, because from an ACL rehab perspective, you'll probably find that they'll either reduce their entry velocity to offset loading on that limb. But a really interesting thing is, I don't think anyone's actually reported this, apart maybe from some of the people at sports surgery clinic, but they'll alter the trajectory during the change of direction to reduce the redirectional demand. So rather than loading up and decelerating with a penultimate, they'll start to curve to turn a 90-degree cut into a 70-degree cut. So there are bits of technology now, LiDAR, for example, even GPS can give you the coordinate data. I don't think anyone is actually considering the trajectory during these tasks. Obviously, load monitoring is advancing. GPS has done wonders to change the game. At 10 hertz, I don't think is enough if you want to properly characterize these high intensity change direction and decel actions, but there are other aspects of advancements in technology. And I think traditional GPS metrics aren't quantifying multi-directional load that well. So I would encourage people to read some of the work by Andrew Gray, who's developed a system where they actually are quantifying these change direction actions and putting it into their overall mechanical work and load monitoring perspective. Because the example he uses is 2 athletes could be running at 5.5 meters per second, box to box. And then one athlete carries on running linearly, one athlete's running at 5.5 meters per second round the center circle, and a GPS metric will tell them they're both doing the same thing when mechanically they're not. One's doing a curved sprint around the box and one's doing a linear run. We're just going to have different biomechanical and neuromuscular costs and loads associated with that. Then ultimately, I think we do need to see more intervention-based research. So yes, it's great to understand the mechanism, and we're trying to do some mechanistic research as well, but we need to understand what interventions can reduce these surrogate measures, and potentially maybe what is the minimum effective dose, as well as with any quality, because some practitioners may not have enough time to spend 3 hours doing technique work. But I think Jesus Alvarez showed with his PhD 3 9-minute sessions per week reduced or improved movement quality, and kind of like, was it League 2, League 3 kind of standard players in Spain. So that's kind of where I see it go. We're going to get some better advancement in the screening, the profiling and monitoring, and hopefully some advancements in training interventions. MRIs are getting a bit more accessible if there is a way of monitoring ACL loads, and obviously we've got wearable sensors as well potentially. Insoles are becoming massive as well from a load monitoring perspective, potentially get impact ground reaction forces and free moments and that type of stuff. And then you can start looking at foot to foot and limb to limb potential differences. It's all about buy-in though with the players as well, ultimately. Whether they'll buy in and wear these bits of equipment is another question.
Yeah, I think the AI obviously is a big topic now, and I do believe it can very soon play an important role, especially in, I think, identifying those players risk for an ACL injury, more from, again, like a movement perspective. I'm not sure you will be able to identify a player and then being like 100% sure that the ACL will happen, but at least it can definitely help with those players. Maybe they're not that trained from a high point of view in looking at certain players with predispositions. For example, they haven't worked with enough ACL players, or simply they haven't seen an ACL injury before. But it can definitely help those coaches in trying to understand which is the player with the predisposition and why that predisposition is happening. We know already via video analysis that we can have information, as we said before, around the context where the potential ACL injury can happen. The AI can potentially add more information from like a limb control point of view, or trunk or pelvis, so like everything that is strictly linked to the mechanism of the ACL injury, to a point that we can potentially in the future maybe screen some players and try to drag down some like quick information about which is the level of predisposition they have for that specific injury. I don't really think it's going to solve the problem completely, but at least we can identify those players at risk. And then as coaches, we can intervene with strategies or methodologies, as we discussed before, around movement retraining or football drills in specific contextualized situations. But at least I think that once this kind of like AI movement investigation, they can potentially be combined also with investigations more around physical qualities. So like hip internal range of motion, hip external range of motion, ankle dorsiflexion, for example, because there's so many that obviously we didn't list today, but there's so many, I would say, physical quality and structural deficit that, as if accumulated, that can potentially lead to an ACL injury, apart from the situational pattern where the injury happened. Even after the injury, for example, when I work with players after surgery, I do find that they always have restriction in hip internal rotation. So at that point, you have the gluteal muscle, for example, they don't provide such a stability to the pelvis, and then your movements become knee dominant and quad dominant again. So there's some structural qualities, I would say, and that can potentially be changed if you have a more comprehensive screening. So I think my point going forward is AI can help you to identify some players faster, but once you identify the player, they need to intervene with some strategies that we technically have already in place today in terms of assessing, for example, ankle and hip, which is very simple to do. We know most of the footballer, they are anteriorly pelvic tilted, they have really stiff ankles, and these are both risk factors for an ACL injury. So there's definitely certain strategies that we can put in place, but AI potentially will help us to save time between the moments we find the player with the predisposition and if eventually the injury will happen or not in that specific day. I see the AI intervention more effective for me in that specific way. But I do think that kind of like skilled video analysis scientists, they can potentially identify some players at risk, as we said before, based potentially on a certification, I would say, or classification of the risk. We know that is again like a defensive injury. So obviously having like a video analysis a bit more focused on some like defensive situations, trying to understand some of the players, we said before, performing them in the right way or not, you're already reducing the risk of someone picking an injury. So I think we don't need to wait the AI to kick in and give us the right answer. I think there's so many things that we can do today as well with just the simple, as Tom said before, just simple phone or camera on the picture. I do like, for example, so much to do like different videos when I've got ACL reconstructed player on the pitch performing certain movements the first time, just because it helped me to understand, as we said before, if they're actually retaining that movement quality I try to develop in a safe and controlled environment, because at the end of the day, I want them to retain certain movements before going into reactive situation. And I'm simply using my phone or sometimes like a camera from the iPad. So I don't think we need such a huge amount of technology. But obviously, if we're talking about professional elite environments, there's more money involved. Definitely that is the right environment probably to have some applications from AI software and new technologies coming out in the future.
You have analyzed a lot of different subtopics: kinetic, kinematics, screening tools, technique modification, isokinetic, technology. But to me, the more special is understand the game, understand the situations. And I think that is a good summary of this FSI talk, is to understand the sport, the football, because there are a lot of different situations, different moments, and it's very important to player to self-regulate all efforts. Guys, this is the end of the FSI talk. It's a great pleasure the level of this talk. Thank you so much, mates, and see you, I'm sure, in the next FSI talk, because I think that we have to do another part to talk about this very complex topic. Thank you so much.
Thank you, Alberto. Such a pleasure for me. Thank you very much. And
Tom,
Tom as well.
That's good for the opportunity. It's great to chat with you both.
Thank you to the listener, and see you in the next episode.
FSI Talks, where football experts from around the world share practical and updated knowledge with the FSI community.